Hello everybody, I'm Dr. Rekha from Bangalore, launched by Mrs. Himaja and Mr. Anil. Now I'm here to tell you about what I understood by the topic diabetic awareness. Actually, in India, there are about 20 crore people are either pre-diabetic or diabetic. In that, 5% are that 20 crore, 5% are type 1 diabetes. That is, in diabetes, we have two types, type 1 and type 2. Type 1 diabetes is mainly insulin dependent, so it cannot be cured by our lifestyle modification or diet. Whereas type 2 diabetes is mainly due to the insulin resistance. So, we need to understand what the insulin resistance is. So whenever in our body, whenever we take glucose, that is the carbohydrates, the it gets converted into glucose, and this glucose has to enter the cells. So for this, the insulin is necessary. So the first function of insulin is it helps the cells to take up the glucose, and the second function is whatever the excess glucose is there in the blood, that gets stored into the adipose cells as fat. This is also a function of insulin. So why the insulin resistance occurs is it is mainly because of our food habit. We take multiple times and mainly the carbohydrates. So whenever we take the food, the insulin will be released. So, and this insulin will help the cells to take up the glucose, but cells will not take the unnecessary extra glucose, only the required amount it takes. So when we take food so many times, the extra glucose what is there in the blood will get converted into fat and gets stored there. So when we take so many times, when we take food so many times, what happens is the glucose what happens is the cells become resistant to the insulin. So this is the insulin resistance. So after that, once the person becomes resistant to insulin, even if even if the insulin is there, the cells will not be able to take up that glucose, and glucose level will be high in the blood. That is how the type 2 diabetes occurs. So now this becomes an fat storage disease, because the excess glucose gets stored as fat, and this fat gets accumulated in causes various complications. So this can cause diabetes, hypertension, or overweight, because of overweight, arthritis, then heart diseases, kidney diseases, stroke, PCOD. There are so many complications occurs with this. So coming to the type 2 diabetes, now we should know the symptoms, how it presents. So basically there are three main symptoms of in the initial stages. There are three main symptoms. One is polyuria, that means they pass urine so many times. The frequency of urination will be more, and they feel more hungry, and along with that they feel more thirsty. So this they should not confuse with weather changes. So whenever they have these symptoms, they have to confirm it by blood tests, by fasting sugars and postprandial blood sugar, and along with that, if they have HbA1c is one more blood test which will give the value of the past 3 months. So these are the basic symptoms of. There are many other symptoms, but these are the basics, the initial symptoms of diabetes. And now coming to the coming to the complications of what diabetes, it can cause damage to the heart, it can cause damage to the vessels, it can cause, that is, it can cause damage to the eyes, retinopathy we call it. It can cause damage to the kidneys, nephropathy, or it can cause diabetic ulcers. So there are various complications of that. And coming to the causes of diabetes, there are various causes. It can be autoimmune disorder, it can be genetic predisposition, or it is due to the overweight, and so like that there are many causes. So in our diet, here in Welson's diet, it is possible to reverse completely the type 2 diabetes with diet in a span of 3 to 4 years. So for this, it is a customized diet where the people with diabetes have to get the blood tests done, so that we can, depending on the blood value, of lipids and serum creatinine. If kidney is involved, serum creatinine will be altered, and lipid alterations is there, we have to modify the diet. So it is a customized diet basically. And here mainly in this diet we give high protein diet, and with intermittent fasting, so that during intermittent fasting the lipolysis occurs and high protein will also not release the not increase the glucose level. With this diet we can completely reverse the diabetes in a span of 3 to 4 months. Thank you.